Hi, my name is Simabong George Kenneth. I'm applying for MSc Adult Pre-Registered Nursing in GCU. I'm attending to the interview questions. Question number one. Why do you want to become an adult registered nurse? I grew up with my parents in their own house. In that house, we had so many tenants, and almost all the tenants in that house were nurses. This happened because there was a big hospital, or there is a big hospital opposite my father's house. Those nurses were lovely. I was very close to them. I learned so many of their practices. This even made me to be administering first aid to others as a normal thing. I remember then, if any of my siblings was having a high fever, I knew exactly what to do to calm the temperature down before they are being taken to the hospital. Also, there was this family friend of mine who was involved in a fatal accident. This with other three people. So the other three came out with serious injuries and broken bones, while she came out without any physical injury, and also there was no broken bone. She could stand without any support, but she was complaining of abdominal pain. So they were rushed to the hospital, and the medical team that day in the hospital focused their attention on the other three that had various physical injuries and broken bones. Before they could come to her, it was too late. She was in pain, seriously in pain. So they were able to detect that she had internal injury that made her to bleed internally. She was rushed into the theater, but she could not make it. It was already too late. I knew that day that if I was to be a nurse, nothing would have happened to that my family friend. Question number two. What are the most important skills and qualities you possess that would make you suitable for nursing? I possess a very good communication skill. As a trainer in Women Affairs and Poverty Alleviation Department, I had opportunity to train women on personal hygiene, child immunization, and family planning. I tried my best to make this idea meaningful to them. They loved it and embraced it. This made the participation of children in child immunization increase. They brought their children in their numbers, and that center was known for the many people that comes for both immunization and family planning. The head of the center was very happy with me, and she congratulated me for that kind of skill I possess. I am also very courageous. I also possess care skills, and I have managerial abilities. Question number three. Please explain what you understand as being the role of adult registered nurse. Okay. An adult registered nurse provides medical care, and they also support the recovery process of patients suffering from acute and long-term illnesses. As a caregiver, they help patients regain health through healing processes. Care must be given adequately as an adult registered nurse. They also assist doctors with examination and deciding what care to be given to a particular patient. They clearly communicate to patients and their family. Without clear communication, it is impossible to give care effectively. They also communicate verbally and in writing the problems of the patients to the members of the medical team. They are also protectors because they maintain safe environment for patients from possible adverse effects of diagnostic or treatment measures. They also confirm from the patient if they are allergic to the medical or to the medications given to them. An adult registered nurse provides comfort and support to their patients emotionally. This will help them stay strong through the recovery process and help them recover quickly. Question number 4. Can you think of a team situation where your communication skills have been essential? Please tell us more about the situation and how you contributed. When I worked as an assistant supervisor in Beloxe, one of the food processing company here in Nigeria, I happened to work in their canteen department. At first, I noticed that their food, the recipe needed to be um to be updated because the test was not good, and the people were complaining. The people, that is the staff we feed, were complaining of the taste of the food. I could not do it alone. As an assistant supervisor, I had to communicate to the supervisor to gain approval. So thank God I told the supervisor about the request of the staff concerning the recipe of the food we produce for them. She was happy and she accepted the idea. We improved on the recipe and we teach other staff of the kitchen. From that day, the taste of the food was improved, and even those that did not always want to come to the canteen started coming because of the quality of the food in the canteen. The supervisor was very happy with me for the improvement and also we were recommended by the owner of the company for the year's award. Question number 5. How do you think registered nurses can show compassion and empathy to patients like Smart Macmillan? The accident that happened has really affected Smart Macmillan. He is paralyzed and cannot do those things he used to do before with ease. As an adult registered nurse, one should understand the emotional trauma this man is going through. Try to look at things in his own perspectives. Create a very good relationship with him. At this point, the Smart Macmillan will be comfortable with your company, and this will help him believe in you and stay strong through the healing processes. Thank you.